Given that cities and states all across the country are now in crisis, now is the time that we should be relying on science. And yet, the Trump administration doesn't seem to share that sentiment. Late this afternoon, the New York Times broke a stunning bit of news about how the White House has further sidelined the CDC. Quote, the Trump administration has ordered hospitals to bypass the Centers for Disease Control and Prevention and beginning on Wednesday, send all coronavirus patient information to a central database in Washington, a move that has alarmed public health experts who fear that the data will be distorted for political gain. Quote, from now on, the Department of Health and Human Services and not the CDC will collect daily reports about the patient that each hospital is treating, how many beds and ventilators are available, and other information vital to tracking the pandemic. The news is said to have come as a shock inside the CDC, but it's just the latest assault against an institution that the White House has been trying to neuter for months now. Today, 4 former CDC directors wrote an op-ed blasting the way the agency has been politicized under the Trump administration. Quote, the CDC is home to thousands of experts who have for decades fought the deadly pathogens such as HIV, Zika, and Ebola. Despite the inevitable challenges of evolving science and the public's expectation of certainty, these are the people best positioned to help our country emerge from this crisis as safely as possible. Unfortunately, their sound science is being challenged with partisan potshots, sowing confusion and mistrust at a time when the American people need leadership, expertise, and clarity. It's not too late to give the CDC its proper role in guiding this response, but the clock is ticking. Joining us now is Dr. Richard Besser. He was one of the 4 former directors of the CDC who today published this op-ed in the Washington Post entitled, "We ran the CDC. No president ever politicized its science the way Trump had." Dr. Besser, good to see you again, and thank you for joining us.
Thanks, Ali. Nice to be here.
You and your 4 colleagues who ran the CDC wrote in the op-ed in the Washington Post, public health experts face 2 opponents, COVID-19, but also political leaders and others attempting to undermine the Centers for Disease Control and Prevention. Richard, I want to remind our viewers that a couple of months ago, the CDC had prepared, it had already been done, a document that would allow churches, schools, workplaces, everybody to safely return to work and to reopen. And for some reason, that document was shelved. It was kept from the public, and nobody at the CDC could explain why the White House was hanging on to it either. We're trying to figure out what's behind the CDC's politicization of or marginalization of the CDC.
You know, Ali, I think one of the biggest challenges we face in this response is this division, this clash of messages between public health, which is all on the same page, that this is a crisis. This is something that is in the early days, and what we do today will determine how many people die over the next months to face our nation. We have steps we can take as individuals, and if we follow public health science, we will save lives. On the other hand, you're seeing politics being injected into this public health response and the dire consequences of that. You see a lack of trust by the public in what scientists are saying, and you see a division in terms of what people are doing based on politics and party. And that is dangerous for the entire nation.
You and your colleagues who wrote this op-ed have worked at the CDC at different times and under different presidents, and when we have faced public health threats. This is by far the most serious, but it's not the only public health threat that America has faced. You say you've never seen anything like this. Have you seen anything sort of like it? I just didn't know the CDC. I understand there are moments where people are interested in it doing political bidding, but generally speaking, I've never seen it politicized by the administration this way.
Well, you know, I worked at the CDC for 13 years, and, you know, I've never been prouder of any aspect of my career. It's full of incredibly dedicated civil servants, patriotic Americans who are working to protect lives here and around the globe. I led emergency response for 4 years and led the agency during the H1N1 swine flu pandemic, during the beginning of that. And, you know, when you develop guidance, you do it based on the best science, and it goes through a clearance process. So different agencies can comment on it. The White House can comment on it. And it's important that policy is part of that process and that conversation. But once a guidance is released, I've never seen an administration undercut the guidance of the CDC. The whole process is designed so when it comes forward, politicians and scientists can unify behind that, and by doing so, encourage the American public to take the actions to protect their health that the public health scientists say are warranted.
Let me ask you about this decision by the Trump administration. I'm just going to quote from the New York Times, ordering hospitals to bypass the Centers for Disease Control and Prevention and beginning on Wednesday, send all coronavirus patient information to a central database in Washington, a move that has alarmed public health experts. Not even sure what that's supposed to mean. What do you think it means?
Well, over the course of its history, there have been power struggles between CDC, which is located in Atlanta, and some of the people who work at the Department of Health and Human Services in Washington. And one of the great things about CDC being located in Atlanta is that it can step aside from a lot of the politics that you get with any agency that's based in Washington. The decision to have hospitals directly report to Washington rather than CDC makes no sense. CDC is the agency that needs to receive that data, needs to look at what's happening in states. If they're getting data on how many people are hospitalized and how many are in the ICU, CDC needs to be able to look and see how does that correlate with actions that states have taken. Who's being affected? Are they getting data that's broken down by race and ethnicity to ensure that everyone in every state and every county has what they need to be safe? You don't want that information going directly to Washington, where it can be influenced even more by politics.